We will talk about joint pain. What are the most common causes of joint pain? When person has joint pain, we should think first about osteoarthritis. Osteoarthritis affects around 27% of world population over the age of 25. It means it's very common condition and it's responsible more than 50% of joint pain. And during osteoarthritis, our normal joints and normal cartilage is break down over time and we get degradation of joints and joint pain. It's progressive disorder, which means it progresses over time and worsens over time. And what are the most common symptoms of osteoarthritis? It's pain in the knee, hips, hands, and spine, but most common manifestations are in the knee and in the hip. And person can wake up with pain. It is called morning stiffness. Also, this pain can occur during physical activity or some time after inactivity. Osteoarthritis causes reduced flexibility and reduced motion of this joint and cracking and grating sound, and this condition worsens over time. It's more common among older adults. This is osteoarthritis, most common cause of joint pain. And treatment is non-steroidals, also acetaminophen. Acetaminophen effectiveness is not very high, it's around 10 to 20%. Ibuprofen is more effective, naproxen is considered very effective, and topical creams also effective. In severe cases, corticosteroids and hyaluronic injections are used. Physiotherapy also important, physical activity, weight loss also important because it's common among obese or overweight persons. Second most common cause of joint pain is rheumatoid arthritis. Rheumatoid arthritis is different from osteoarthritis because here we have inflammation. In case of osteoarthritis, inflammation is leading process. Yes, there is some inflammatory processes in the joint, but inflammation is not major characteristic. And here we have inflammation as a major characteristic. It's autoimmune disease, which means that our body attacks mistakenly our cells and our tissues, and at this case, it attacks our joints, and we get this inflammation and this pain. And another differentiating aspect is that rheumatoid arthritis affects usually small joints, while osteoarthritis affects usually large joints. So we can think about rheumatoid arthritis when person has symmetrical or both-sided hand joints, inflammation and pain. It's rheumatoid arthritis. If joint pain is on large joints and only one-sided and not symmetrical, it is osteoarthritis in many cases. But if it's symmetrical and if it's on small joints, it's rheumatoid arthritis. And rheumatoid arthritis can have fatigue and fever, and rheumatoid nodules also, and it's autoimmune in nature, and over time it can cause joint deformities also. It can have extra-articular manifestations also, like skin inflammation, lungs and eyes. So rheumatoid arthritis affects not only joints but other parts of the body, and over time it causes joint deformities, you can see, but it requires time and is already serious condition. What is treatment? Treatment is disease-modifying anti-rheumatoid drugs. For example, methotrexate and sulfasalazine are very classical examples of disease-modifying anti-rheumatic drugs, and JAK inhibitors also is more modern versions of these drugs, and their main characteristic is that they suppress immune system function. And corticosteroids also used and also effective. Third most common cause of joint pain is gout. It's responsible around 10% of cases, and gout usually have attacks, usually at night, and gout attack is very severe but short term. And this attack is provoked many times after intaking foods which are rich in purine. Such foods are meat, fish, alcohol, and some vegetables like spinach. The idea of gout is uric acid crystal deposition in the body, especially in the joints, and it causes inflammation and pain. This pain is severe. And treatment is non-steroidal, colchicine also, and intake of a high amount of water to flush out uric acid crystals. It's important part of treatment also, and avoid foods which are rich in purines, and eat foods which does not contain or contain very minimal purines. For example, white bread or white rice and bananas and several other foods contain very low or non-purine. And we have several other causes also which can cause joint pain, like bursitis, tendinitis, soft tissue rheumatism, like fibromyalgia. But such cases usually are correlated with trauma. And in case of fibromyalgia, we have some psychological component, and its mechanism is not fully understood. And in case of bursitis, tendinitis, they are most commonly correlated to overuse this joint and trauma, and they can cause pain also, and usual treatment is non-steroidal anti-inflammatory drugs also. And in case of fibromyalgia, there can be anticonvulsants and also antidepressants also. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.